Africa has the youngest population in the world, with 200 million people aged between 15 and 24 falling within the youth bracket. This current trend indicates that this figure will double by 2045. In this regard, investments made in Africa's youth population today will determine the development trajectory of the continent over the next 50 years and position Africa as an influential and united global player and partner as envisioned in Agenda 2063, the Africa we want. The African states are at various stages in their demographic transition, and as such, there is need to accelerate the desired transition in the population age structure. In this regard, AU member states have endorsed a roadmap to guide the implementation of relevant activities aimed at achieving the objectives of the theme, which is harnessing the demographic dividend through investments in youth. On the margins of the second session of the Specialized Technical Committee on Health, Population and Drug Control, the African Union Commission and the United Nations Population Fund UNFPA co-hosted a ministerial working lunch on family planning, a critical investment for the demographic dividend, and the AU Agenda 2063. Excellency El-Fadil Amira El-Fadil Mohammed, AU Commissioner for Social Affairs, addressed the participants on the importance of the demographic dividend for Africa.
Harnessing the demographic dividend was an investment in youth. Remind us that early, appropriate, and strategic investment in youth empowerment and child rights are vital in reaching the demographic transition and ultimately reaping the dividend. The AU roadmap on harnessing the demographic dividend guides us with its strategic pillars. Agenda 2063 has set a clear outline for the Africa we want. Honorable Ministers, ladies and gentlemen, let me conclude my speech by thanking the UNFPA for the collaboration to host this lunch. We appreciate your support and collaboration and your commitment to the implementation of our programs.
Mr. Kwabena Oseidankwa, Director of DGM UNFPA, was honored to establish the link between UNFPA supplies and Africa's priorities, stressing on the 2017 AU's roadmap on the demographic dividend.
Please permit me to start by congratulating Her Excellency Amira El-Fadil for her election and assumption of office as Commissioner for Social Affairs. Let me also acknowledge His Excellency Dr. Abdul Rahmani Diallo, Interim Chair of the STC. Excellencies, ladies and gentlemen, at the 1994 International Conference on Population and Development held in Cairo, 179 member states committed to the groundbreaking program of action which shifted the focus of population policies from demographic targets to investments in the human rights, well-being, and capabilities of all individuals. 20 years after, as a testament to the enduring relevance of those commitments, the 54 African Union member states adopted the Addis Ababa Declaration on Population and Development beyond 2014 at the 2013 Regional Population Conference here in Addis Ababa. UNFPA has continued to work with member states individually and collectively in this regard. UNFPA remains the major partner supporting AU member states in the procurement of family planning commodities and in the implementation of family planning programs.
Family planning Particularly, universal access to modern methods of contraception is the main investment that will trigger the needed demographic transition. Dr. Senan Yunton, the team leader family planning UNFPA, made a presentation on UNFPA supplies and interventions in Africa.
How do we support countries to make sure that the investment in family planning, the investment in commodity security can help achieve the demographic dividend? In the history of humanity, there was no country who has achieved emerging economic status without an investment in family planning, because it's so correlated. If your dependency ratio is so high, if the working people structure in your countries, I want you to leave you with that. All the partners in this room, the major partner, the member states, have invested in this major instrument, which is a global public goods in support of national government, which ensure that you have the best products at the best price, and also to invest in innovation. So when you invest in UNFPA through this program, you are also addressing humanitarian setting. And finally, we have an extensive partnership for sustainable solution in country by developing business cases and financing strategy and by unlocking investment opportunities.
An interactive session moderated by Ambassador Olawale Mayegun, the Director for Social Affairs of the African Union Commission, provided an opportunity for the ministers, donors, and other key stakeholders to discuss the issues of family planning and commodities in Africa moving forward. Various representatives from both governments and international organizations were in attendance. Among them was the World Bank, IPPF, GAVI, private foundations, and UN agencies. They further shared their experiences on the family planning and how to finance these commodities in Africa.
But it's time to hear your voice, or your voices, and also for the young people in the audience to speak out. When I say give money to UNFPA, but invest in young people, we know the problems, we know the solutions, and we just got to have the courage to make sure that we meet the unmet needs of the young and the adolescents. How far are we prepared to reduce the support provided by partners into our national development plans? The floor is open.
The message we are putting on the table is that our government is not relenting in our efforts to address the population growth and to harness the demographic dividends.
Thank you. You see, I'm going to put some people on the spot.
Depuis la Révolution, elle a monté un tout petit peu. D'ailleurs, en Tunisie, on cherche à comprendre. Bon, il y a quelques réponses qui sont claires, mais je préfère laisser deviner.
After the revolution, there are a lot of changing in our strategy. It's related to the social issues.
We actually beginning to utilize our early childhood development centers to distribute contraceptives since they are free, but also linking the contraceptives to pre-exposure to PrEP.
So Rwanda as well, we have a very high fertility rate. So I think what we need to focus on going forward, of course with partners like UNFPA and many more, we're looking at how can our population take on long-term family planning methods, because that has revealed to yield more results and more impact in the long run. The male involvement has been always an issue.
Canada remains a good supporter, and Excellency, Distinguished Ambassador, let me ask this. What are the perspectives you wish to highlight, and what is your response and key messages based on what you've heard?
This is a very impressive gathering on a crucial issue. Minister Bibo, along with my boss, Prime Minister Justin Trudeau, announced an investment of $650 million over 3 years in funding for sexual and reproductive health and rights.
The United States remains a steadfast partner for Africa's development, and the United States also recognizes the importance of being able to truly have a demographic dividend. So we are truly committed in the importance of investing in young people's access to sexual and reproductive health, including family planning services, which are key to enhancing the quality of future generations of the African workforce. We strongly believe that education empowers girls, and it also empowers boys. And so together, men and women are able to champion the necessary choices that are the first steps to achieving this demographic dividend. We truly support the idea of African countries, AU member states, taking a leadership role in their national development plans, including on family planning.
AU has made substantial progress in promoting girls' and women's rights on the continent, and the Maputo Protocol is actually very, very progressive. It goes beyond access. Attitudes have to change, as we heard Tunisia mention, both amongst men and women. And young men and women often are having sex, are sexually active before it's culturally acceptable. That is a fact. As such, young men and women have to have access to information and healthcare that can protect them from STDs and HIV and unwanted pregnancies.
C'est pourquoi la France est aux côtés de ses partenaires africains, toujours mobilisés pour soutenir les programmes de santé et de droits reproductifs et sexuels. Depuis 2011, nous avons investi plus de 500 millions d'euros dans des programmes multilatéraux ou bilatéraux pour les droits reproductifs et sexuels. Et l'an dernier, nous avons adopté une nouvelle stratégie pour les 5 prochaines années sur ces questions de population et de santé et de droits reproductifs.
We are continuing investing in voluntary family planning, in particular through the Family Planning 2020 partnership, from which progress have been made so far, and the UK is delivering its commitments in increasing access to 120 million women and girls from the poorest countries of Africa, and this commitment will be continued. Thank you for giving us this chance.
Thank you, Excellencies, Honorable Ministers, distinguished ladies and gentlemen. In summary, we have emphasized the fact collectively that commodity security and family planning is central to our national development objectives as well as the development objectives of the African Union. We have also identified challenges which require us to find innovative mechanisms, both at national level and at continental level, including extensive partnerships to address the issues. And so, we as the United Nations Population Fund, we commit to working with individual member states with particular strategies aimed at optimizing the physical space, addressing the social challenges, and building the partnerships necessary to make this sustainable.
As his closing remarks, the chair of the second STC on Health, Population and Drug Control, His Excellency Dr. Abdurrahman Diallo, the Minister of Health of Guinea, echoed his opening statement with the slogan, "No product, no program, no commodities, no program."
I actually decided to make my closing remarks from a commodity security angle. It is unfortunately still very donor dependent. I mean, I would like to ask in this room, how many countries completely buy their needs in terms of contraceptives? I'm not necessarily expecting an answer, but it's just to put it on the table. I feel like we need to go one step further and help countries structure budgets a little bit. I know there will be variations from country to country, but definitely coming up with a scheme in terms of proportion for supply chain management for commodity would be an interesting thing.
In this particular session, we have shown that without family planning, there is no way we'll be able to reap the demographic dividend. We've shown that without investment in our young people, there's no way we can reap the demographic dividend.
This session was very rich, and member state countries really appreciated UNFPA supports in providing a country with a unique tools, a unique platform to continue support them towards sustainable solution in investing in youth for demographic dividend.
And so we've had a fulfilling session with the ministers, with our donors, and with a range of partners. And we look forward to implementing the concrete recommendations that have come out of that session. Thank you very much.